When support systems are disconnected from the school environment, struggling students often feel entirely alone in a crowded hallway. A few years ago, the standard for a school mental health vendor was simple: provide licensed professionals, accept active insurance, and maintain HIPAA compliance. Today, those features are the absolute bare minimum. A new set of standards now separates outdated legacy vendors from genuine school partners. This quadrant compares administrative effort against actual student impact. In the bottom left, the status quo: passive hotlines and flyers take zero effort, yielding zero measurable impact. Up in the top right, the modern standard: a dedicated therapy team specifically assigned to your building. Improving student outcomes starts with moving past low-impact commodities and choosing a partnership that actually shares the work of student care. For administrators in Georgia, upgrading the system is no longer optional. The catalyst forcing this change is House Bill 268. This timeline shows the narrowing window administrators have to act, leading directly to the strict legal compliance deadline in July 2026. Relying on generic telehealth platforms that lack built-in workflows for these specific legal requirements exposes districts to immediate compliance risks and heavy liability. Operationally, these legacy systems are already failing. Schools are paying for unused services while their students languish on 2-week waitlists for a single appointment. Administrators face a clear choice. You can maintain the low-friction status quo, or you can invest the organizational effort required to integrate a dedicated partner like MentalSpace School. Switching vendors does create temporary administrative work, but doing nothing leaves students without timely care and leaves the district legally exposed. Let's use this comparison matrix to look specifically at how care is delivered, starting with team structure. Legacy models route your students through a massive pool of random call center employees. MentalSpace assigns a specific, dedicated team directly to your school building. Your students see the exact same culturally competent therapists every time. They build genuine, familiar relationships. That consistency yields results. Schools using this model report an 89% improvement in student attendance and an 85% satisfaction rate among families. Instead of a stranger on a screen, students talk with a professional who genuinely understands their specific school environment. To get these results, administrators have to treat the external vendor as a direct extension of their own internal staff. This means integrating MentalSpace therapists into your building's unique culture, matching your communication flows, and understanding your daily routines. Continuity of care drives positive outcomes. Achieving that continuity demands active inclusion rather than passive outsourcing. Bringing our scorecard back up, let's compare the speed of access and crisis capabilities. Standard vendors typically operate on 9-to-5 schedules with 2-week waitlists. MentalSpace provides same-day teletherapy access and around-the-clock crisis response. Intervening immediately catches problems early. Rapid response reduces severe student anxiety by 92% and stops hallway escalations before they start. But there is a trade-off. Same-day triage only functions if your on-site school staff actually know how to use it. This requires breaking old administrative habits and mandating training on MentalSpace's specific crisis response protocols. Immediate intervention prevents crises, but its success relies entirely on your administration taking the time to train your staff on new tools. Finally, looking at the last 2 rows of our matrix, we evaluate financial accessibility and compliance safety. MentalSpace accepts a broad network of insurance providers, but most notably, it offers a $0 Medicaid structure. This removes financial barriers for families in Title I schools and diverse socioeconomic brackets, providing care without draining your district's budget. Looking at compliance, MentalSpace builds FERPA and HIPAA-aligned data practices directly into its automated workflow, fully satisfying the HB 268 mandate. To make the finances work, administrators must coordinate securely on the front end to collect and process family insurance and Medicaid details. To ensure legal compliance, the district must abandon its legacy data practices and migrate completely over to the vendor's secure communication channels. Total legal safety and equitable mental health access are achievable at zero cost to the district, provided your team manages the initial data onboarding. We can map district readiness on this decision tree to see if MentalSpace is the right fit. We'll start with the No branch. If your district wants a low-effort, check-the-box vendor to satisfy bare minimum requirements, this is not for you. Paying for a premium platform with dedicated teams is a waste of resources if you are unwilling to integrate those capabilities into your daily operations. If your leadership wants a hands-off Band-Aid rather than a true extension of your staff, this partnership will fail. Shifting over to the yes side, MentalSpace is built for districts facing the HB 268 deadline, managing high Medicaid populations, and actively seeking a dedicated therapy model. Dedicated teams and same-day access are the specific operational mechanisms that actually lower student anxiety and improve daily attendance. If you are ready to evaluate your district's readiness for 2026, visit MentalSpaceSchool.com to schedule a partnership conversation. Preparing for the 2026 mandate involves choosing a partner that embeds into your daily ecosystem to create a safer environment for every student.